Stroke. It attacks without warning, leaving behind irreparable damage that can cause severe disability or even death. A stroke occurs when the blood supply to the brain is interrupted or reduced, preventing brain tissue from getting oxygen. Within minutes, brain cells begin to die. There are two main causes of stroke: a blocked artery, an ischemic stroke, or the leaking or bursting of a blood vessel, a hemorrhagic stroke. Both of these can cause severe neurological damage, such as speech disorders, limb paralysis, walking difficulties, and in severe cases, death. In the United States, some 800,000 people are injured from strokes each year, and a major portion of them remain paralyzed and require significant rehabilitation. These patients are added to stroke patients from previous years. Treatment is expensive. Altogether, it costs the United States some $34 billion annually. In addition, 1.5 million Americans annually sustain a traumatic brain injury, TBI, with 230,000 survivors requiring rehabilitation. The rehabilitation process for both stroke and traumatic brain injury patients is lengthy, dependent, expensive, and requires the ongoing support of the family or caregiver. The recovery process today requires daily visits to overbooked rehabilitation centers, causing many stroke and TBI victims to skip some of their rehabilitation sessions, reducing the chance of returning to reasonable daily activity. This is where Rehabit-Tec comes in. Rehabit-Tec offers a personalized upper limb training device for stroke patients. This independent, complementary home care treatment is driven by state-of-the-art minimized technology based on Rehabit-Tec clinical research. Rehabit-Tec focuses on improving upper limb function at home using a training device that allows a stroke and TBI patient to train his injured hand by using his own healthy hand, thereby training the injured part of the brain to improve its functioning. The system is simple and intuitive, providing detailed training programs with on-screen explanations and even recommendations for continued treatment. All under an overall rehabilitation program supervised by medical teams with rehabilitation expertise. Rehabit-Tec team recently identified a treatment based on a novel clinical study for the upper limb tremors of Parkinson patients. The potential is huge. The combination of minimizing system components with a set of motors that operate each finger individually, the option of daily home care, and an affordable target price for home use devices can turn Rehabit-Tec into the default device for upper limb rehabilitation. Rehabit-Tec, rehabilitation is in your hands.